If your loved one was just diagnosed with dementia, it can be overwhelming and very scary, and you may wonder what's going to happen. These are all common, normal questions that everyone asks when their loved one is just diagnosed with memory loss. Memory loss can often be a progressive illness that starts with just forgetting a few things and progresses to worsening problems with memory and ultimately problems with things like function and being able to dress and get out of the house. I think there are lots of challenges to caring for someone with memory loss day to day. One of the most common things that I hear from caregivers is that they keep asking the same question over and over and over, and that can be really stressful for the caregiver. It's important to remember that they're not doing it to annoy you or to make you angry, but instead they just don't remember.
The more somebody forgets and the more we remind them of their forgetfulness, the harder it is and the more pain it causes. So sometimes it's really interesting to actually join them in that conversation. Do you remember when you got this job? Do you remember when you had that job? What was most meaningful to you about your work? So that you're creating meaning from the memory, if you will, and you become the presenter of the memory. There's so many nice things that have to do with reminiscence. So looking at pictures together, do you remember this? Do you remember our wedding? Do you remember whatever, the christening, and so on and so forth. So you are creating in that moment, moments of value and meaning to the person and also to yourself.
In addition, I think caring day to day for someone with memory loss can include things like taking care of things like making sure there's food in the house, making sure that the bills are being paid, making sure that they're getting to their doctor's visits on time, and making sure that they have the care that they need at home to help with things like bathing and dressing and feeding themselves. I think it can also be difficult when caregivers realize how stressful it can be to care for their loved one. Often caregivers feel burdened or angry or sad, and then they feel guilt because they feel burdened or angry or sad.
It's really difficult to accurately explain the frustration of caring for someone with dementia. Simple things don't happen. Asking someone to go set the table doesn't work anymore. Moving something, they think you stole it. It's almost impossible not to yell, not to scream, not to walk out the door and feel like I'm never going back. I'm throwing the keys over my shoulder, I'm done.
And it's important to remember that all of these emotions and reactions are normal and that all caregivers feel this when caring for someone with memory loss.
What you need to make sure that you never do is live this journey in isolation. You have to seek outside help and support.
Healthy practices when caring for someone with memory loss include things like making sure you're getting out of the house every day, trying to make sure that there are other people who may be able to spend time with your loved one with memory loss so that you can have a break. It's important that you take care of yourself over the course of the memory loss to make sure that you can continue to help your loved one in every way they need.